Hello, thank you for joining me for talking about teacher noticing and nurse anesthesia. My name is Melissa Kapfer and I'm a third year student with Virginia Commonwealth University's Doctor of Nurse Anesthesia Practice program, and we're going to be discussing my DNAP project. As part of this project, I explored the concept of teacher noticing and whether this was an appropriate practice to adapt to nurse anesthesia education. While teacher noticing has been more extensively studied in teacher education, it really hasn't been introduced at all to CRNA education. As an SRNA, I've had the privilege of experiencing firsthand how meaningful it is when faculty recognize student learning needs before their struggle becomes a major barrier to learning and affecting their clinical performance. This experience has led me to ask whether there are evidence-based strategies that could enhance the skills so faculty members are more readily confident and intentional with their response to student needs. Today, I will briefly introduce the teacher noticing framework, summarize what the current literature tells us, and discuss a few practical ways we can incorporate this framework into nurse anesthesia education. One thing I've really learned as an SRNA is that academic struggle isn't something that just occurs overnight. There are generally subtle changes in the student first, some that can be very difficult to identify if you don't know what you're looking for. Some students become more withdrawn during class, participate less during classroom discussions, appear more anxious, hesitate during simulations, and second-guess themselves when presenting their anesthesia plan. There can be some early warning signs that they need additional support even if they aren't technically failing academically. The challenge for faculty is to determine which behaviors need attention, especially as our CRNA programs grow in size, and how to respond appropriately, because this is going to become harder to achieve. The teacher noticing framework offers a structured way for a teacher to approach this process. It encourages educators to recognize, interpret, and respond to student learning needs in the moment before the student academic or clinical performance declines. Teacher noticing is commonly described in the literature as a three-step process. First, it recommends noticing, therefore attending, to important student behaviors or cues. Next, it recommends interpreting those observations and what they might mean. Finally, it encourages educators to decide how they should respond and if they need to adapt their instructional plan. These steps sound straightforward, but the literature makes a clear distinction between passive observation of students and the more effective, active noticing that ends in thoughtful lesson plan development and decisions surrounding the observations. Regardless of the educational setting being studied, this three-step framework was consistent across my literature review. When I first heard about teacher noticing, one thing immediately stood out to me. CRNA faculty, by nature of the work they do outside the classroom, already possess many of the cognitive skills that teacher noticing requires. Every day, anesthesia providers have to continuously monitor their patients, recognize subtle physiologic changes, prioritize multiple sources of information, solve problems under immense time-intensive pressure, and communicate effectively throughout all of this with interdisciplinary teams. Because of this, the framework of teacher noticing won't require DNAP faculty to develop any new skills. Instead, it builds on these strengths and requires a new environment to apply them. Instead of recognizing patient changes, it is now targeting student needs. Studies comparing novice and expert teachers found that experienced educators identified meaningful classroom cues more quickly. They were able to focus on information that was more instructionally important. They could interpret student behaviors more accurately, and they were more flexible in adjusting their teaching accordingly. What I found interesting was that the literature did not attribute expert noticing simply to the years a teacher was in practice. I would have assumed that teacher noticing naturally improved as educators gained years in their experience, but the literature suggests that experience alone isn't enough to improve noticing. Instead, the improvements came from time spent by the educator actively reflecting on their practice, structured feedback, and faculty development activities. To me, this finding is encouraging because it suggests that teacher noticing is a skill that can be developed throughout an educator's career and is something new teachers can adapt to enhance their practice as well. It shows that it's a teachable skill that can be cultivated as time goes on. Across the studies included in my literature review, several strategies were associated with improving teacher noticing. These included structured reflection, mentorship, guided observation, and video review. The intervention with the strongest overall evidence was video-based reflection. Multiple studies, therefore, found that educators who reviewed recordings of teachers' teaching sessions, reflected on student interactions, and discussed those observations demonstrated greater improvements in noticing than those who relied on teacher experience alone. One thing I appreciate about the teacher noticing framework is that it can be easily adapted into current curriculum because it doesn't require major changes to be effective. Faculty can start practicing it simply by identifying one or two student behaviors they want to intentionally observe during class or simulation. Afterwards, just taking a few minutes to reflect on what those behaviors might mean and how teaching can be adjusted helps complete the noticing framework. These are small changes, but the literature does suggest that these, in being used in practice, can gradually strengthen an educator's ability to recognize student learning needs. Even though teacher noticing has not been studied specifically in CRNA faculty yet, a lot of reported benefits from noticing aligns with the goals nurse anesthesia education already has. This method for promoting earlier recognition of learning needs may allow faculty to intervene sooner. Hopefully this leads to students receiving more individualized support rather than waiting until they are significantly struggling to receive it. Over time, this may improve student engagement, confidence, learning, while also strengthening faculty decision-making during teaching. It might also foster more trust and connection between students and their faculty members. Another important point from my literature review included teacher noticing as it extends beyond grades or performance. Students of CRNA programs come from diverse educational backgrounds, clinical experiences, and personal circumstances, as they should. The same behavior might have a very different underlying cause depending on the specific student. Several studies found that educators initially attributed some behaviors like withdrawing from discussions to the student's motivation to learn or ability to. After reflection and student feedback, they started to recognize that those same behaviors often actually reflected anxiety, challenges with inclusion, and other barriers to learning. This reinforces the importance of remaining open about why a student might be struggling before making any assumptions, and why noticing can be very caring for our students. In summary, teacher noticing is an evidence-based framework that offers a structured approach to recognizing and responding to student learning needs. My literature review suggests that teacher noticing is a learnable skill that develops through intentional practice rather than teaching experience alone. The strongest strategy for improving teacher noticing across the literature has been video-based reflection and is emerging as a focus point for educational training. Although additional research is needed on teacher noticing's framework's influence specifically with nurse anesthesia education, I believe this framework has the potential to complement the strengths CRNA faculty members already possess and ultimately improve earlier recognition of SRNA needs.